Heart disease, women. Our team members' names are Florida Lewis, Vanessa Magnum, Marcus Miles, Aisha Mitchell, Elizabeth Lozano Munoz. Our title page, topic and assessment data, heart disease, women, income status. Our table of content consists of the thesis statement, identification through assessment measures of the health issues of problem, heart disease, and how it affects the target population, women, risk factors, other demographic information outlined by ecological assessment measures, how the two essential services that revolve around assessment, monitor health and diagnose and investigate, applies to heart disease, women, and ensure that a community health assessment is accurate. More women than men die of heart disease. According to the American Heart Association, only 1 in 5 women believe they have heart disease. They believe that heart disease is their greatest health threat. Men and women both suffer from heart disease, just not necessarily in the same way. Heart disease starts with a buildup of plaque in the blood vessels, and if untreated, can lead to heart attacks. Coronary heart disease, also known as coronary artery disease and ischemic heart disease, is a disease of the heart blood vessels that, if untreated, can cause heart attacks. Like any muscle, the heart needs a constant supply of oxygen and nutrients that are carried to it by blood in the coronary arteries. When the coronary arteries become narrow or clogged and cannot supply enough blood to the heart, the result is coronary heart disease. Risk factors that are controlled: being overweight or obese, sedentary lifestyle, that means little or no exercise. Obesity and sedentary lifestyle are more common in post-menopausal women. Older women may be particularly prone to inactivity and obesity, and both are strong risk factors for heart disease and stroke. Smoking accounts for the vast majority of heart attacks in women under the age of 45 and is a huge multiplier of risk in women who have a family history of heart disease. The combination of smoking and using birth control pills increase the risk of early heart disease by 20-fold. High blood pressure or hypertension is a major risk factor for heart disease and stroke. It is common in women over 55, and evidence suggests that hypertension in women is often undertreated. High cholesterol and other lipids greatly increase the risk of heart attacks and stroke. Diabetes, type 2 diabetes, is becoming even more common, right along with one of its root causes, which is obesity. Diabetes should be thought of as a disease of blood vessels as much as a disease of sugar metabolism. The risk of heart disease in women with diabetes is increased as much as 6-fold. A diagnosis of metabolic syndrome is particularly common in postmenopausal women. An increase of C-reactive protein is a new risk factor that may be more important in women than men. Using birth control pills, especially if you are also a smoker. Risk factors that are non-controlled include family history of premature coronary artery disease or stroke occurring in male family members younger than 55 or in female family members younger than 65. You are 55 years or older. You are postmenopausal or have had your ovary removed. During any pregnancy you experience preeclampsia, and that is especially high blood pressure. African American women are more likely to die of CAD than Caucasian women, mainly because they are more likely to have more risk factors, including high blood pressure, diabetes, obesity, and smoking, and more likely to receive poor health care than Caucasian women. Heart disease risk is also higher among Mexican American, Native Hawaiian, and Native Indians. This may be partly due to greater rates of obesity and diabetes in these groups. You can take steps to lower your risk of developing cardiovascular disease. Do not smoke or use tobacco products. If you have high blood pressure, use diet, exercise, and medication to control your blood pressure. Exercise strengthens your cardiovascular system and keep your weight under control. Eat a healthy diet. Be careful your intake of salt and saturated fats. Eat plenty of fruit, vegetables, and whole grain. Reduce stress as much as possible. Each year, the American Heart Association, in conjunction with the Center for Disease Control and Prevention and the National Institute of Health, bring together the most up-to-date statistics on heart disease. Death rate from cardiovascular disease have declined, yet the burden of disease remains high. In 2007, overall death rates from cardiovascular disease was 251.2 per 1,000. The rate was 294.0 per 1,000 for white males, 405.9 per 1,000 for black males, 205.7 per 1,000 for white females, and 286.1 per 1,000 for black females. On the basis of 2007 mortality rate data, more than 2,200 Americans died of cardiovascular disease each day, an average of one death every 39 seconds. Current policies. Each year, the American Heart Association produces scientific statement and guidelines to promote the mission of reducing death and disability caused by heart disease. The policy agenda is focused on the Association 2020 goal to improve cardiovascular health of the U.S. population and reduce mortality rate both by 20%. The policy agenda covers heart disease and stroke research priorities around nutrition, physical activity, tobacco control and prevention, access to quality and affordable health care, system of care, and nonprofit issues. You can be an advocate. Go Red for Women. It's organized not only to raise money for heart disease and stroke research, but to advocate for heart disease in women and to teach women how to prevent heart disease and to reduce their risk of having it, as well as allowing women to be a support system for each other, to know they are not alone suffering heart disease. Many Hearts My Life. To build healthier lives free of cardiovascular disease and smoke. My Heart, My Life is to help educate people about cardiovascular disease and stroke. This group also helps educate how to live better, eat healthier, and exercise correctly to control and prevent heart disease and strokes. Policy development. Our community could be more involved with the AHA and raise money for causes as well as awareness. The community could have workshops for nutrition, exercise, and healthy lifestyle. Changes to help working parents keep kids aware of heart disease. The schools could teach about heart disease in PE classes and teach kids the real importance of healthy exercise, as well as having nutrition classes to help kids learn how to make healthy eating choices before they develop heart disease. New insight and innovative solution. Roughly 50% of women with heart disease show normal coronary arteries compared to 17% in men. Women who undergo coronary angiography for evaluation of chest pain frequently have no evidence of obstructive coronary disease. In 50 to 60% of cases, the initial presentation of ischemic heart disease in women is an acute myocardial infarction or sudden cardiac death with no prior report of chest pain. If chest pains occur, it is usually uncharacteristic of typical angina pain traditionally ascribed to heart disease. Women who experience chest pain and undergo normal tests for CVD will oftentimes show no signs of CVD. In these cases, CVD should not be ruled out, but other tests should be done. Recently, newer tests that are designed strictly for women have emerged and have helped in detecting CVD when traditional tests fail to do so. Newer tests include coronary artery calcium screening. The coronary artery calcium score is an independent predictor of coronary heart disease risk and therefore may help in describing how aggressively to pursue cholesterol-lowering antiplatelet therapy and other primary prevention strategies. Endothelial function evaluation. Endothelial function can be assessed either invasively by injecting acetylene into the coronary or brachial artery, or non-invasive by performing brachial artery reactivity testing. Those with abnormal endothelial function are at greater risk for CVD. Functional capacity assessment. Functional capacity assessment is one of the strongest and most consistent prognostic indicators for cardiac disease and can be easily assessed. This is done by using a questionnaire that utilizes self-reported physical work capacity to estimate peak metabolic equivalent. The lower the score, the higher the chances of having CVD. Other options preventing CVD are pharmacogenical, being informed on family history of CVD, CVD secondary prevention, screening and identification, cardiac scans and risk scoring, modification of risk factors in patients, behavioral changes, for example, diet and exercise changing, and quit smoking, adherence to medication, taking all required medication, policy of information for developing countries, providing low-cost intervention resources for poor countries who show high risk for CVD, CVD management for specific population, management of CVD in women, and indigenious and in the poor. Assurance activity. One of the most important functions of public health department in the United States is enforcing and managing programs that protect the health of population and their jurisdiction. These services are available through the assurance function. The assurance function of public health refers to verifying that priority services identified as part of the assessment and policy-making function are always available to the population, that services are effective in meeting the needs of the population. Enforcement of laws and regulations. Enforcing laws and regulations that protect health and ensure safety for women with health disease in low poverty areas has been a fight for years, but now there is help with the Affordable Care Act. President Obama signed the Patient Protection and Affordable Care Act into law. This reforms our nation's healthcare system. It holds the promise of dramatically improving the health of women throughout their lives. The Act aims to provide all Americans with quality and affordable, comprehensive health insurance. It includes reform to ensure that insurance companies will not exclude coverage of individuals of the condition for which they need care, financial assistance to help individuals with limited income to attain affordable coverage. It links people to health services and ensure that they receive care. Obamacare creates several new ways to get health coverage. For individuals and families with low income, Obamacare expands Medicaid coverage. Some examples of the ACA provision are eligibility, which fills in current gaps in coverage for the poor